let's just take a moment as a community, as a Zoom room community, right hand on the heart, left hand on the belly. Just take a moment, a sweet moment for yourself to arrive here from there, whatever your morning has been like and whatever time zone you're in. Just appreciating all these wonderful humans here. So, welcome, welcome. We're gathered here today at 11 for a 90-minute fantastic presentation. So, my name is Jayne Gumpel, for those of you that don't know me, and I'm the co-founder of Relationship Resources and creator of a model of care we call Cultivating Joy, which is very much in alignment with our talk today, a core practice philosophy of positive psychology and psychiatry, really efforting to change the message around illness and suffering, right? Because we all suffer. So really pulling back the curtain and looking at our humanity in a very different way through a positive lens. Today, I represent Big Tent Ketamine, BTK. A shout out to Carl Spitzer, who is the founder and owner of Big Tent Ketamine, which I encourage all of you to join if you haven't already. And we're recording this talk and it'll be posted on the Big Tent Ketamine site. So a little plug for that. I belong to it. I have many friends on Big Tent Ketamine. It's a tremendous resource. If you're not already a member, I recommend it. So it's my pleasure today to introduce to you Amanda Sacks-Zimmerman. She is an amazing human being, a neuropsychologist. She's a thoughtful and deeply compassionate clinical neuropsychologist whose work lives at the intersection of brain health, emotional well-being, and the lived experience of aging. So she's trained and faculty at Weill Cornell Medicine, and she's also the co-founder of a beautiful center in Lower Manhattan called Acheron Psychiatry with her husband and co-founder Daniel Zimmerman, who is a psychiatrist and also an amazing, deep, loving human being. Amanda brings both academic rigor and clinical depth to her work with particular expertise in cognition, memory, mood, and the psychological challenges that can accompany aging. What distinguishes Amanda is not only her scientific precision, but her relational presence, which is, so important in the learning experience and in our practice experience. She has a gift for making complex neuroscience understandable, humane, and immediately useful to clinicians and patients alike. And I know that firsthand because we went through her slide presentation yesterday and it was fantastic. And I learned so much. And I'm not a neuroscientist or a neuropsychologist. Her approach honors the whole person, recognizes that changes in the brain are always embedded in a life story shaped by meaning, loss, resilience, and connection. Amanda's work reminds us that caring for the aging brain is not simply about assessment or diagnosis, but about dignity, curiosity, and helping people feel seen and understood at every stage of life. We are deeply grateful for her generosity in sharing her wisdom with our community. And if you're interested in this topic and you're interested in learning from Amanda, you can contact her. She'll put her email in the chat. She's also doing a wonderful retreat on this topic at Acheron, which you might want to check that out, Acheron Psychiatry. We'll put it in the chat as well. The way this is going to go this morning is Amanda will do her presentation. She has some wonderful slides for us to learn from. So without further ado, again, welcome all. I will pass this on to my colleague and friend, Amanda.
Thank you so much, Jayne, for that beautiful introduction and describing me in the way I would love to be described. So thank you so much. And thank you everyone for being here and listening. And I can't wait to hear from everybody after we go through these slides. So as Jayne said, I'm a neuropsychologist at Acheron Psychiatry, and I'm going to be speaking about a topic that really has become so deeply meaningful to me because throughout my life, both in my personal and professional life, I've been shaped, guided, and lifted by the wisdom of older adults. I would not be where I am today without the insight, perspective, and the mentorship of these individuals. So their contributions have left an imprint on how I think and work, and this is really a testament to those folks. So my goal is to cover these aspects of aging and how they all relate to each other. So please bear with me. We're going to go through a lot, but as Jayne said, this is recorded. So don't feel a need to kind of take notes or anything like that because you will have a recording of this. So let's get the bad news out of the way. There are age-related changes in the brain, and they become more apparent as we get older, even as old as 45. The brain atrophies, meaning it shrinks, especially in areas of the frontal lobe and the hippocampus. These are areas involved in what we call cognitive control and making new memories. There are white matter changes, so these nerve fibers that have myelin on them that carry nerve signals between brain cells, they shrink with age. That results in less speed and efficiency of communication between brain areas. We often feel that as being slower or slowed processing speed. The brain also tends to generate less chemical messengers, which play a role in some of the declining cognitive functioning and memory, as well as increased depression that people can experience in older age. Blood flow to the brain gradually decreases as blood vessels stiffen and become less efficient. So all this is bad news, but I promise I'm getting to the good news. So bear with me. So just to take a moment to kind of reflect on these quotes, I'm sure a lot of us have experienced these moments where you think you should remember someone's name or you couldn't remember the thing you were supposed to do. And what I'm going to talk about is how all of these complaints actually relate to attentional control, processing speed, and executive functioning, and not necessarily our memory system. So one of the theories of aging has to do with what we call this frontal lobe hypothesis. And what that means is that there are a lot of cognitive changes in older adults because of sort of that atrophy to the frontal lobes, specifically the prefrontal cortex, which is really sort of the most anterior part of the brain. And that shrinks more than other parts of the brain. The thing about this region is it's responsible for executive functions. And executive functions basically control how we use our cognitive functions. It controls how we use our attention. It controls how we hold multiple pieces of information in our mind. And tasks and cognitive functions that rely on that cognitive control decline the most as we age. Most of our cognitive functions rely on that executive control of our thinking. And that includes how we use our memory and our language. So the efficiency of communication between the frontal lobes and other brain regions naturally decline. And why is it important to know the impact of aging on the frontal lobes? Because the changes in our frontal lobes can be responsible for normal and benign cognitive changes that are not indicative of a neurodegenerative disease like dementia. So while some of these cognitive changes can be frustrating, like not being able to recall a word or a name as soon as we wanted to, it does not necessarily indicate a disease process. So another thing to point out here is that age-related cognitive issues are related to this idea that cognitive domains are interdependent. This interdependence of language, memory, executive functioning, attention, it's a natural design of our brain functioning at every age. But it becomes important to understand how reductions in attentional control, executive functioning, and processing speed contribute to what we all are so worried about as we age, which is basically memory problems. So I'm going to sort of try to describe how these other cognitive functions really impact memory without the memory in and of itself being particularly declined or dysfunctional. So reduced attention interferes with our new learning, and that interferes with how new information gets into our memory system. So what is that restaurant that my spouse said we were going to? You might not have been paying full attention to be able to process this information into memory. Reduced executive functioning interferes with how we pick out and zone in on important details and organize that information. So in reality, that information never gets fully processed into memory because we don't really pick out those details automatically. Also, we are slower to process information. So that gets in the way of being able to process large amounts of information. So we're often hearing, seeing, reading large amounts of information that we don't necessarily have the speed to keep up with processing so that it gets into memory. So again, just understanding how these cognitive functions are interdependent and how it can disrupt memory without anything necessarily being wrong with the memory system is important for us to realize. So just to reiterate, the rumors are true. Cognitive functioning does change in aging. And again, it's really specifically related to that frontal cortex diminishment. What that results in terms of what we experience is we have difficulty controlling where our attention goes, difficulty being able to hold multiple pieces of information in mind at the same time, which is a lot of what happens when we're conversing with others or trying to figure out complex problems, and slowed processing speed. We can become more distracted, less able to switch between going from one thing that requires a mental set to another, less able to take in a lot of details in a quick moment. All of this can seem like memory problems, but in reality, it's related to this less efficient connection between the frontal lobe and other parts of the brain. The good news is coming again. Good news. Neuroplasticity. I'm sure everyone has really heard of that. And it really is a process that happens throughout our lifetime, but it really kicks in the context of a brain injury. And it also really kicks in the process of aging. So neuroplasticity is this intrinsic property of the brain that allows it to adapt and reorganize itself throughout life. It allows the aging brain to undergo adaptive changes that maintain our cognitive functioning and our resilience. And it involves a lot of adaptive brain changes, which I'm going to go into in this next slide. So first and foremost, I just think we want to sort of take a step back and really digest this, that we recognize that the brain is changeable and can compensate for all those neurobiological changes that I've already talked about. One such change, that is a neuroplastic change, is that we rely on both sides of the frontal cortex as we age. So rather than just being sort of more left-leaning in the brain or right, we start to integrate both sides of the frontal cortex, which helps us with that cognitive control. Another neuroplastic change as we age is that the left hemisphere of the brain, which holds our general verbal knowledge, our semantic memory, so our memory for facts and events, our language comprehension, that all lives in the left side of the brain. The left side of the brain starts to sort of work double time as we age. It's more resilient in the face of aging. So all that to say is that our left brain is really still able to support new learning, certainly new verbal learning as we age. Neurogenesis, or the growth of neurons, also still happens in adult brains. And this is more recent in terms of like sort of the neuroscientific understanding of neuronal growth. In fact, neurons do grow, and they especially grow in the hippocampus, which is really the seat of our ability to remember new things. There's also strengthening and reorganization of neural networks as we age. And so that's a major reason why we can have wisdom, emotional regulation, creativity, pattern-based reasoning. These things become stronger as we age because of this neural network reorganization, which again is this neuroplastic process that kicks in as we age. So BDNF, there's a lot of sort of neuroplastic factors, but I thought this was good to highlight because it's so important to recognize what it is and how we can actually modify it as we age. So BDNF stands for brain-derived neurotropic factor. It's a protein in the brain. It helps brain cells grow. It strengthens connections between brain cells for learning and memory, and it helps maintain our speed of processing. So BDNF, in all of what it does, it helps support resilience in aging. It does decrease as we age. However, it is modifiable. In other words, we can boost it through everyday habits. There's been a whole lot of literature on ways in which aerobic exercise increases BDNF. Sleep, meditation, behaviors that reduce stress, learning, healthy diet, all of those can increase BDNF despite the natural reduction as we age. So I think this is sort of just a good thing to freeze on because we can meaningfully increase this protein. And it is through lifestyle changes. So these lifestyle changes aren't just good in and of itself, but because of also the effect it has on BDNF. Everyone with me so far? I'm going to keep going. And again, there'll be a lot of questions, so please write them down if you have them, put them in the chat, and we'll get to them. So I'm going to talk about this interplay of cognitive reserve and neuroplasticity in older adulthood. So why do some individuals better compensate for these age-related changes? It has to do with this reciprocal relationship between cognitive reserve and neuroplasticity. So cognitive reserve, you might have heard this term before, and there's a whole lot of definitions of it, but basically it's accumulated through our lifestyle choices throughout our lifetime. So it includes what we do on a regular basis socially, what we did with our lives vocationally, education-wise. It's really this accumulation of knowledge base. It's our reservoir of knowledge that we've built over time. This accumulated flexibility, pattern recognition, and knowledge strengthens our existing brain networks and actually supports the recruitment of alternative brain networks as we age. So that's where the interplay happens. Basically, this cognitive reserve actually allows for greater neuroplasticity as we age. So the more cognitive reserve we have, the more efficient use of our brain networks, and the more continued neuroplastic processes we have as we age. So even if cognitive reserve is all of what we've built in the past, the good news is that it's not fixed. We're actually able to continue to evolve our cognitive reserve across our lifespan. It can be built at any age by engaging in activities and habits that strengthen our neural networks and create alternative pathways for thinking. How does this happen? Well, it happens through lifelong learning and engagement. The other good news is that neuroplasticity is not a fixed entity. It's actually experience dependent. So in other words, the brain and its neuroplasticity will take what you give it and undergo the neuroplastic changes to accommodate the new knowledge you present to it and create the networks to accommodate that new knowledge. And that is where that cognitive reserve and neuroplasticity meet in the middle. So stimulating your brain with diverse activities, varied knowledge sources, helps optimize our very innate neuroplasticity. So they work together dynamically to keep us thriving in terms of our brain health. You control the evolution and enhancement of this cognitive reserve, which then takes advantage of the natural mechanisms of neuroplasticity. And so that's where we sort of come up with this saying that we want to use your capacity to the fullest, or you might not necessarily lose this God-given capacity, but you might not be using it to its fullest capacity and potential. I'm going to take a moment just to talk about neurocognitive strategies that can help with the aging brain. This is my bread and butter. This is what I do with patients in CRT or cognitive remediation treatment. But now that we've sort of gone over this idea of neuroplasticity and the idea that the frontal lobes are really sort of driving a lot of the cognitive dysfunction, these strategies have a context now. So we know the aging brain has neuroplasticity. We know that the diminishment in cognitive control and slowed processing speed are what contributes to much of these age-related cognitive changes. Then we can implement some straightforward daily strategies that help support our cognitive control and compensate for the slowed processing speed. Some of these you might already use, but this might give context into why it is important that you're actually using them. So the first one is this idea of zoning in on important information a priori, meaning before you actually go into the thing that you're going into to take in information. So rather than making the brain do all the work of figuring out what's important from a large amount of information, like a conversation or a book, you kind of go into the situation knowing what might be important for you to remember. So for example, let's say you're going out to a dinner and it's with a good friend. The idea is you kind of tell yourself, what are the 5 things I want to remember about what this person is saying? And you sort of do that a priori, knowing that you're only going to pick out these 5 details. You might pick out more just to happenstance. But if you go into it a priori, you have a natural filtering system. So you offload some of the cognitive load, which can tax that processing speed, that slowed processing speed. Writing and repetition. So when you write brief and bullet-pointed notes about what you just heard or read, it further creates a cognitive filtering system where you are only focused and processing what you write and filtering out the rest. Small bits of information like bullet points are much easier to process than long narratives. Repetition. I cannot say this word loud enough. The more you rehearse or repeat information, the more time you allow for deeper processing within the brain. So if you write 5 bullet points that are important for you to commit to memory, you rehearse that information until you think it's solidly in that short-term memory bank. That is purposeful, effortful use of your frontal functioning. And what's great about writing is that it freezes that information so it doesn't go anywhere. So again, it's compensating for that processing speed and it allows you more time to rehearse that information. And that actually works with a very natural circuit in our memory system called the Pepez circuit. I don't go into it at all, but that Pepez circuit works on firing and wiring together and it requires constant repetition. Organizing information. So back in the day, we sort of all remember having mnemonics when we studied in school, rhymes or funny phrases to recall information like Roy G. Biv for the colors of the rainbow. These things work. And why do they work? It's because it gives the brain a way of making sense of information and relating it to something that's already solidly encoded or solidly inside our memory bank. So the good thing is we can make a creative or funny phrase about almost anything. And if you take the time to do it, you're organizing that information so that you have more efficient recall of that information. And we often don't give ourselves the time. We often don't give ourselves the time to rehearse or organize information. And we kind of pay the price with that because, again, those frontal lobes are not working as well. So the way to compensate for that is really to give ourselves more time on the front end by giving ourselves time to repeat, giving ourselves time to organize information. Giving yourself cues rather than relying on spontaneous recall is very important. So we want to make sure we have cues that we give ourselves. So for example, rather than think to ourselves, well, I'm just going to remember that I'm meeting my friend at the Old Stone Cafe at Monday at 4. Why would I forget that? She's my closest friend. That's likely not going to happen on its own spontaneously. We need to put that in the daily planner, double up with an alert in the phone. These are natural cues that we can give ourselves. Spontaneous recall does not work well as we age and can be one of the most frustrating things as we age. So try not to do that to yourself. Put those alerts, put those cues in, because that's going to help us, again, bypass the diminishment of the frontal lobe functioning. Finally, present-mindedness. When it comes to neurocognitive functioning, it means a whole lot more than what we're trying to do when we meditate. Present-mindedness means that we're aware of our present state of mind if we're doing something cognitive. So if in your present state of mind you become aware that you're distracted by anxiety or fatigue, those are not good times to take in a lot of information. It also means you need extra support through all the strategies we just talked about so that you can fully process information. So again, if you're in an anxious mind, it's definitely the time to write things down. It's definitely the time to ask for information to be repeated. More positive news about aging. So with aging comes great potential for wisdom. True wisdom develops over time through the accumulation of knowledge and life experiences. In fact, some of the literature says we need critical and even disruptive life experiences to develop wisdom. Wisdom can be thought of as the creation of almost cognitive templates, like mental blueprints for a variety of situations that can make our ability to solve problems and make decisions much more efficient. Some of the key components to wisdom include intuition, so this ability to just know without having to extensively think about or analyze things. Competence, and that comes from repetition of skills that are so well practiced that we don't have to put a whole lot of mental effort into it to perform. So those are sort of the natural outcomes of wisdom. But there are also psychological factors that contribute to wisdom. That includes a willingness to reminisce and reflect about life-changing experiences, tolerating uncertainty and unknowability of some of those experiences, being open to what past experiences might mean, and the emotional regulation to be able to take a more transcendent view of those life-changing experiences. When I talk later on about ketamine, this is going to be relevant. This idea of self-knowledge and self-transcendence are two of the core psychological pillars that allow wisdom to emerge. They shape how a person understands themselves and navigates life's complexities. We all naturally have blocks to self-knowledge, and that can hinder the development of this wisdom. So again, the good news is that these psychological factors that contribute to wisdom can be modified, and we can choose to reflect on the past experiences to develop that self-knowledge, which then further feeds this development of wisdom, which I'm going to talk about later in the context of ketamine. So more good news is this interaction of aging, wisdom, and creativity. So again, as we age, we accumulate knowledge, experiences, those blueprints that contribute to wisdom. Creativity, a little different than wisdom, involves generating new ideas, seeking different connections, and thinking flexibly. Creativity as we age can actually be enhanced by how we develop our wisdom. So life experiences and that accumulated knowledge provide a rich foundation for putting all these sort of discrepant pieces of information into one creative solution, depending on what it is. And as older adults, we might be actually better at applying all that accumulated knowledge in innovative ways and connecting ideas across discrepant domains. So with this ability in older adults, creativity is a little bit different. It manifests more as being insight-driven, blending all that experience with imagination to be able to innovate and create. So wisdom actually provides this very rich foundation to be able to create, especially in ways that are more insightful and purposeful and based on that lifetime of experience. So none of what I've talked about happens automatically. There are choices we make as we age. So even with all these age-related cognitive changes I was talking about, like the slowed processing speed, reduced working memory, diminished attentional control, wisdom, creativity, and the ability to learn can continue. We have the brain architecture to make it continue and should continue. So engaging in learning creativity, it builds on our wisdom and that cognitive reserve, and it strengthens resilience and supports brain health as we age. But how we choose to engage these capacities and reservoirs of knowledge is up to us and the choices we make. So just to kind of put this together, our brain's neurobiology will meet us where we take it. In other words, the knowledge that we intentionally seek out, the experiences we choose to engage in, the behavioral habits we purposely practice, the brain's neurobiology, that neuroplasticity, will adapt accordingly. In other words, the brain will meet us where we take it. So some of the questions that might be going through everyone's mind, well, how do I build neuroplasticity? How do I build cognitive reserve and get to that wisdom factor? I thought about this and I was thinking, I'm definitely reluctant to produce sort of like a rigid list of behaviors to grow wisdom and creativity because these processes are going to be deeply individual. And what fosters growth for one person might feel irrelevant or actually forced for another. So that's not going to work. So rather than providing that laundry list of new habits, I would ask that all of us think about maybe shifting the lens in terms of how we engage with what we're already doing. So wisdom can emerge when we approach an activity we're already doing with a renewed curiosity or intentionality. For example, how can I engage with my craft or my vocation in a way that is different from how I typically do? And this sort of reminded me of my father-in-law. He's an architect by trade. He's actually still working. And what he started to do was put together different items that would be found at some of the construction sites he was working at, like wood, tiles, cement, and metals. And he started to use those materials artistically, almost like a mixed media artist would. And he started to create artistic structures from these materials with an architectural kind of wisdom behind it. And the result were these sort of really neat, like sort of structures that you could deem as art. But again, it came from this sort of renewed way of looking at what he did and how he put together these elements that he had been using really in his architecture career all along. Further, you can ask about any particular domain of life that you've always been curious about and think about how do I turn that into something actionable? Is that something I can learn? Is it something I can read about? This is so important to, again, engage our neuroplasticity. And some of these decisions are not just about learning or filling the time, but this idea of really knowing that those decisions add to our cognitive reserve and increase our neuroplasticity. In terms of exercise, I just want to say a couple of words about that because we all know exercise is good for us. I talked about it in terms of adding to that BDNF, but what's actually starting to come out, and certainly in the rehabilitation world, is this idea of dual tasking. And what that means is walking and thinking at the same time. And there's actually a whole group of people who are starting to design exercise equipment that are sort of having treadmills that have you walk on those treadmills while you're actually cognitively engaged, trying to figure something out, trying to pinpoint targets. And so there are companies that are actually producing this dual tasking equipment. And in a theater near you soon is going to be cognitive gyms where you might walk into a gym and there's a treadmill, but you actually also have to use your cognitive functioning at the same time. And my colleague actually who's in Israel right now is developing this equipment. And I'm excited for what that will bring to our neck of the woods. Okay, so again, I do sort of look back at all of what I'm saying, and it sort of seems like, okay, well, why not build wisdom? And why don't I do all the things that were talked about in terms of building wisdom, cognitive reserve, helping my neuroplasticity? And this is where I think it's worth taking a more psychological perspective on ourselves and ourselves in aging. So I'm going to shift gears a bit and talk about the psychology of aging. And this idea that our socio-emotional development continues across the lifespan. And Erik Erikson was really someone who appreciated that. He really theorized about these life stages that happen in later adulthood. So I'm going to bring up the last of his two stages and the conflicts that arise because it highlights so much of what I've been saying in terms of these choice points that we have as we age. So there are dilemmas as well as opportunities that arise in these two stages of socio-emotional development in older adulthood. When we consider the challenges at these stages, the ideal resolution is toward the positive end of the continuum toward psychological growth. And in looking at these two stages, we want to ask ourselves, what have we been doing all along to support generativity and integrity? And what can we still do or start to do to support these factors in older age? So to go back to his stage 7, Erik Erikson's, individuals grapple with the conflict of generativity versus stagnation. Generativity involves contributing to the world, leaving a legacy, creating meaning that often happens through parenting, mentorship, career accomplishments, and community engagement. That other end of the continuum is stagnation, where we can often feel unproductive, disconnected, lacking purpose. Again, here's where choice points matter, because there are ways to reduce stagnation and promote generativity, which include community participation, taking on greater responsibilities in terms of supporting growth in others, learning new skills. Stage 8, where we face the conflict of integrity versus despair. When we enter this stage, it's often in the context of loss and major changes in daily roles. So integrity at this stage involves a sense of fulfillment, coherence, and acceptance of past life. On the other side is despair, where we experience feelings of regret, disappointment, or fear that life was wasted or incomplete. The key pathways to integrity as we age include cultivating meaningful relationships, continuing to nurture connection and a sense of belonging, and taking pride in what we've done, as well as continuing to pursue creativity and mastery. So what's interesting is that the same activities and processes that cultivate generativity and integrity are those that build cognitive reserve and neuroplasticity. And developing wisdom, you are increasing the chances of landing more on the spectrum of generativity and integrity rather than stagnation and despair. So moving through these stages effectively and with intention does entail an acceptance of the past, even forgiving oneself and knowing that there are choice points in the here and now. So what I would ask is, as we're doing what we're doing, is to really look at what these life stages mean and the way our behaviors sort of fit into how we're developing through these stages. So all of what I'm saying now begs the question of why don't we do more of the behaviors that we already know could be good for quality of life, as well as helping to come out on the positive side of these stages of life? So here's some of what might be at play here, and that's our psychological limitations. So we often hold false or oversimplified beliefs about what aging is, right? All older adults have inevitable forgetfulness or creativity declines after 60. We often don't understand or even question these beliefs, but they might be there, and they have a powerful impact. So the impact of these beliefs are that they can contribute to these self-fulfilling prophecies that affect our self-efficacy as we age, as well as our motivation to keep engaging. In fact, you might be avoiding new challenges or experiences because of some of these beliefs. So I know all of us know what self-narrative is, and just to kind of reiterate it, the self-narrative is the story we tell ourselves about who we are and how our life is unfolded. If we have a rigid or overly negative self-narrative that can limit our growth in aging and really reinforce these stereotypes, we can modify our self-narrative to highlight the ways we have been by recognizing our achievements, our strengths, and our ongoing potential. But how often do we do that? How often do we sort of shift from, I've lost this or that ability to, I've actually learned a lot and I've learned new ways to adapt to deal with these issues? If we don't do that, a feeling of stuckness can ensue, and we don't understand that we have to modify this self-narrative. And when we feel stuck, we often feel trapped in monotonous routines, in the way we think, and that can build on itself. It starts to reduce motivation, and it diminishes this emotional growth that needs to happen as we age. I'm just going to say a bit about depression and anxiety, because there's an interesting sort of intersection between depression and anxiety and cognitive functioning. So depression and anxiety at any level of severity really limits the pillars of healthy aging that I've been talking about. And as we know, depression contributes to negative self-narrative, loss of interest, decreased energy. But there's a whole lot of literature on the way depression can negatively impact our cognitive functioning. There's a name for it. It's called pseudodementia. When depression sets in, we have a lot less ability to kind of use that frontal functioning to rally our cognitive capacities. Anxiety really does the same thing. Anxiety and all the ruminations, it really diminishes the bandwidth to have that attentional control and that executive functioning. So both of those sort of effective elements can limit our cognitive functioning. The thing that can get really dark is once anxiety and depression set in, it leads to withdrawal and isolation, which again diminishes those behaviors that are so essential to building wisdom and neuroplastic processes. So the good news is that depression, anxiety, even low-level depression and anxiety, negative self-narrative, these are changeable, they're modifiable. So I often see patients where they say, yes, of course I've been in psychotherapy, but it's actually been 15 years since they've been in psychotherapy. And psychotherapy, especially cognitive behavioral therapy, I'm a little biased in terms of my sort of preference for the type of therapy, but psychotherapy in and of itself can really help move the needle on a lot of these elements, and it becomes so necessary in the aging process. It can help build awareness to these negative self-narratives that have been so built in and repetitive that we don't even question them, and we are going to have to start to examine them as we age if we want to build wisdom and creativity. I think it's worth sort of taking a step back and looking at, well, what is our history of self-narrative? Because the history of self-narrative will certainly dictate our self-narrative as we age. So if someone has a history of negative or poor self-narrative, I've always failed, I'm not capable, that story tends to be deeply internalized, and it influences how we experience our own aging. So someone with a history of poor self-narrative, they may interpret normal aging experiences through an overly negative lens. Prior patterns of self-doubt or self-criticism get amplified as negative factors of aging come about. We may become more vigilant to age-related changes that impacts our motivation to engage in behaviors that really does impact our trajectory of aging. So again, even more important why it's so essential to understand this history of self-narrative and understanding that that didn't just pop up as we age, but might have been there all along. So all this to say, just to highlight, if any of these are familiar to you, what this speaks to again is probably a negative thought pattern that's been there all along and is now being kind of couched or contextualized in terms of our aging. And these need to be examined in order to allow for openness to change of how we're thinking, openness to experiences that will eventually contribute to wisdom, coming out on the positive side of integrity and generativity and resilience in aging. So before we can really work on this, we need to understand that they're actually there and that they can be modified. So hopefully a lot of this talk has really sort of surrounded this idea of coming at aging through a strengths-based perspective. We are able to make shifts as we age to enhance these positive aging factors. We know that we have mechanisms of neuroplasticity to support these shifts. Part of this is recognizing that there are cognitive abilities that are resilient in the face of aging. We can actively engage the brain to maximize these strengths. We can use accumulated knowledge and patterns of experience to support our renewed ability to problem solve and decision make. We can understand and appreciate all the knowledge that's been accumulated over our lifetime. When we have to compensate for weaker cognitive areas by using external supports or strategies, we don't need to self-stigmatize that. They're adaptive. They are not pathological. We also need to examine historical self-narrative because those negative self-narratives that have likely always been there, they limit our growth as we age. We need to start challenging that. We need to start challenging that so that we can unlock our potential for creativity and wisdom. Also, engaging in ways that connect you to community, to humanity, to greater purpose, that provides existential meaning, which then feeds back into our ability to use our neuroplastic processes. So now I'm going to talk about ketamine. I don't know if this is sort of a break point at all, but I do want to get to how ketamine can help all of what I've been talking about. So maybe I'll just go through this fairly quickly, but highlighting the points here, and then we'll go to Q&A. So ketamine, it's sort of amazing. It's an amazing medication, as I'm sure Jayne can attest to, and a lot of people on this call. But looking at ketamine in the context of what we've been talking about is so important because it can really help us find our way to these beneficial aging factors: neuroplasticity, self-knowledge, wisdom, and openness. So ketamine in and of itself doesn't directly build wisdom, but facilitates the growth of wisdom-based factors. So first, and I have another slide about this, is that ketamine is neurotropic, meaning it's naturally building our neuroplasticity. It's been shown to grow and strengthen and reorganize neuronal connections. It increases BDNF, so it makes the brain more adaptable, and that can enhance ketamine's ability to help us learn from our past experiences, which is fundamental for wisdom. The psychological experience of subanesthetic ketamine is that it can reduce rigid negative thought patterns, so it actually opens up the ability to reflect more openly on our experiences of the past. A lot of users of subanesthetic ketamine have reported that there's greater self-insight, greater self-awareness. Again, we know that that's a component of wisdom. Further, and again, this is sort of front and center in what ketamine does and what it's approved for, it relieves depression and anxiety. So by relieving that depression and anxiety, it allows us to engage with life more fully, and especially in an aging brain, that's so important because being able to engage in life, as we've said before, it allows for that building of cognitive reserve and neuroplasticity. So while it doesn't offer wisdom, it really creates these neuronal and emotional pathways that make developing wisdom so much more facile. So I'm sure all of you have sort of seen this and know this, but just to sort of highlight, what's so sort of amazing about ketamine is its mechanism of action is really on the NMDA receptors, which cause this glutamate surge. And that glutamate reserve, and this is where I talked about BDNF, is it triggers this BDNF release. And again, these are all neuroplastic changes and positive neuroplastic changes, which I think shows really the potential of ketamine to help with not only emotional functioning and aging, but also cognitive functioning as we age. a lot of you might be wondering about, the safety profile of ketamine in older adults. And I'm stepping out of my lane a bit just because not an MD here, but sort of basic accepted wisdom about subanesthetic ketamine is that it's absolutely safe in older adults. There are some caveats, and there definitely are some monitoring that has to take place in older adults and some medical evaluation in terms of understanding the interactions of ketamine in older adults, especially older adults with any kind of cardiac dysfunction. But these are well known. These are well known. And again, the suggestion would be that anytime you're going to use ketamine in older adulthood, that these are used with a physician who really understands these parameters when it comes to these interactions with ketamine. There are guidelines for use of subanesthetic ketamine in older adults. And again, any clinician who's using ketamine in older adults is following these parameters, which includes pre-screening thoroughly, especially that cardiac factor, starting at low doses, monitoring closely, avoiding any polysedation. So any medications that contribute to sedation would be stopped before you use ketamine, following any cognitive effects from use of ketamine, ensuring that informed consent takes place before ketamine. And again, the importance, I can't stress enough, of having a trained clinician, specifically a physician who understands these parameters and is incorporating it into the ketamine usage, is extremely important. The only thing I'll say, just because in my other past life, is I was looking at post-operative cognitive dysfunction, and I'm sure we all know ketamine, it's an anesthetic. And so looking at its sort of safety profile when it's used as an anesthetic, not sub-anesthetically, is extremely safe. And in fact, they've called it neuroprotective when it's used in the operating room. So a lot of folks that have operations or surgeries as they get older, when ketamine is used in the OR, there's actually a whole lot less complications that result from using ketamine. And this is, again, not at sub-anesthetic doses. This is used at anesthetic doses for the purpose of surgery. So it has its safety profile in terms of using it as an anesthetic in surgeries is well established. And now it's sort of the burden is on us in terms of establishing its safety profile at sub-anesthetic doses, but that sets the precedent for how safe it is. So bottom line, sub-anesthetic ketamine can be safe and effective in older adults. It could be given at lower doses and needs careful monitoring, but again, it has been deemed to be safe. Before we open this up to questions, I'm just going to sort of talk about Acheron and sort of our mission here is to really have a ketamine-assisted cognitive remediation protocol specifically with older adults based on everything I've already talked about. Really this idea of using the ketamine to derive insight, especially insight into the ways in which anxiety or negative self-narrative has impacted aging, really using that ketamine to help facilitate cognitive functioning, having a strengths-based perspective in terms of how we prep individuals to use ketamine with our protocol for aging adults, and using the ketamine's effect on mood enhancement to further help someone engage in our CRT protocol. And again, I'm just going to kind of close off here with some examples of older folks who really found their way to creativity and wisdom as they aged. So I'm sure all of us know Frank Lloyd Wright, Grandma Moses, Peter Roget, Laura Ingalls Wilder, Colonel Sanders. These are to name a few. All of these folks really had their sort of biggest contributions and innovations past the age of 65, which is kind of amazing, but again, speaks to their sort of living examples of the ways in which wisdom, use of neuroplasticity to support cognitive functioning in older age was used as a lived experience. Okay, so I am done with my talk and I'm happy to talk. And I want to hear what everyone thinks and is thinking now.
Well, first of all, wow, that was fantastic. I just want to give you an applaud there for a wonderful, enlightening, enriching, so interesting discussion. This is perfect. Perfect time for us to say adieu and to appreciate you so much, Amanda, and also a shout out to Carl Spitzer for sponsoring this for Big Tent. Amanda put your email in the chat so people have a way to contact you. It was illuminating, enlightening, and of course, the beginning of a conversation that will be a lifetime of work for you, I know. And also want to plug the center, the Acheron Psychiatry. Daniel Zimmerman, who's a psychiatrist, has an amazing heart, and both he and Amanda are creating this extraordinary center that really focuses a lot on the practitioners, the therapists, creating community there and well-being for the practitioners, which is so important for care. So I want to thank you and have a great day, everybody.
Yes, thank you so much.
Thank
Thank
you,
you.
Amanda.
Wonderful to meet everybody. Thank you.